Welcome to today's webcast from the Agency for Healthcare Research and Quality about the new AHRQ SOPS Workplace Safety Supplemental Item Set for nursing homes. My name is Joanne Sora, and I'm an Associate Director at Westat and the Project Director for the contract that supports AHRQ's SOPS surveys. I'll be the moderator for today's webcast. Next slide. We're going to begin with a few quick housekeeping items. First, if you're having any issues with sound coming from your computer audio, you can connect to the webcast audio using your phone by clicking on Phone Call to find the dial-in number and meeting ID, or call me to enter your phone number and receive a call back from Zoom. If your computer freezes during the presentations, you can try logging out and logging back in. At any point in today's webcast, you may ask a question through the Q&A icon. We encourage you to share your name and organization or role when you type your question. Speakers will respond to your questions during the Q&A at the end of today's webcast. Please note that the raise hand feature and chat are disabled. You can download presentation slides and view the agenda and speaker bios on our event website at https://events.westat.com/SOPS, SOPS. The password is all caps, SOPS 2023, SOPS 2023. I want to remind everyone that there is only one Zoom link for the entirety of today's webcast. If you leave at any time, you can rejoin with the same link provided in your email after you registered. Finally, the Nursing Home Workplace Safety Supplemental Item Set and related materials are now available on the AHRQ website at www.ahrq.gov/surveys/nursing-home/supplemental-items/workplace-safety.html. Next slide. Now I'm happy to introduce our speakers for today's webcast. We're very pleased to welcome Karen Ginsberg, who directs AHRQ's Consumer Assessment of Healthcare Providers and Systems, or CAPS program, and the Surveys on Patient Safety Culture, or SOPS program. I'm also pleased to introduce Tanya Rice, Director of the Office of Patient Safety at East Alabama Health. I'm also introducing Naomi Yount, who was a Senior Study Director who led the development of the Nursing Home Workplace Safety Supplemental Item Set. Again, I'm Joanne Sora, and I'll be moderating today's webcast. Next slide. Here's our agenda for today. We'll start with Dr. Karen Ginsberg giving a brief overview from AHRQ. Then Tanya Rice will share her organization's experiences participating in the pilot test for the Nursing Home Workplace Safety Supplemental Item Set. Dr. Naomi Yount will provide an overview of the SOPS Workplace Safety Supplemental Item Set. And lastly, we'll have time for Q&A at the end. So let's begin, and I'll hand it off to Karen. Karen?
Thank you so much, Joanne, and welcome everybody. Good morning, good afternoon, and welcome to our webcast today on our workplace safety item set for the Nursing Home SOPS survey. I'd like to start off today by telling you a little bit about our agency and the SOPS program. There's some new users, SOPS survey users that are new today to this webcast, so I'm just going to start off by providing you with some context. So on the next slide, please. The Agency for Healthcare Research and Quality is a research agency of the U.S. Department of Health and Human Services, and we are the lead federal agency charged with improving the safety and the quality of America's healthcare system. I want to point out we are going to be talking about surveys today. We are not a regulatory agency. We can't require you to use our surveys or any of the tools or products that we develop. On the next slide, please. At AHRQ, we talk about our core competencies. We invest in research and evidence to make healthcare safer, improve quality of healthcare. We create tools for healthcare professionals to use to improve care for their patients, and we generate measures and data so you can track the progress of the U.S. healthcare system and evaluate its performance. And we feel it's necessary, it's an important part of our mission to get our products and our tools out to you, our users, so we push the science to implementation. to help you be able to use these tools. The next slide, please. Our patient safety priorities at AHRQ are to focus on the areas of greatest impact, extend patient safety improvements to all settings, to prevent healthcare-associated infections and reduce antibiotic resistance, build capacity in the healthcare system to accelerate safety improvements, improve communication and engagement between clinicians and patients, and generally make the safe thing the easy thing to do. So on the next slide, please. Our AHRQ has been funding the SOPS program continuously since 2001, and it's a program to understand and measure and improve patient safety culture within healthcare settings. We develop validated surveys and measures. We support voluntary data submission to SOPS databases. We conduct research to further the measurement and the understanding of patient safety culture. And we create tools to improve patient safety culture in healthcare facilities. And I want to point out that the SOPS surveys are trademarked, and that trademark ensures that they are valid and reliable surveys and have met certain criteria in their development and testing. And the next slide, please. So let's talk about how AHRQ defines patient safety culture. Patient safety culture can be defined as the beliefs and values and norms that are shared by healthcare providers and their staff in an organization. And we say that the patient safety culture determines the behaviors that are rewarded or supported or expected or accepted in an organization as they relate to patient safety. And it's important to realize also that patient safety can exist at multiple levels, from the unit level to the department level, to the organization level, and then to the healthcare system level. Next slide, please. So the SOPS surveys are surveys of providers and staff that ask about the extent to which their organizational culture supports patient safety. You can see that we have 5 different surveys. We started our development of these surveys with the hospital survey. First came out in 2004, and version 2 came out in 2019. The nursing home survey was next, followed by medical office, community pharmacy, and ambulatory surgery center surveys. And we refer to these surveys as our core SOPS surveys. On the next slide, the surveys are customized for each healthcare setting. However, they all focus on these kinds of topics and domains: communication about error, communication openness, organizational learning and continuous improvement, overall rating on patient safety, response to error, staffing, supervisor and management support for patient safety, teamwork, and work pressure and pace. Again, on the next slide. You can use your SOPS surveys to raise awareness about patient safety culture, assess patient safety culture to identify strengths and areas for improvement, examine trends over time, and evaluate the impact of any patient safety initiatives that you might implement. On the next slide, we're going to talk today about an optional supplemental item set, and you can add supplemental item sets to the core surveys to customize your core survey. We have instructions in our guidance, and we'll talk more about this today also, about how to add supplemental items, but essentially they come at the end of the core survey. And I'm going to show you on the next slide a table of our supplemental item sets that have been developed to customize specific SOPS surveys. So for the hospital survey, for example, we have supplemental item sets on health information technology, workplace safety, value and efficiency. And for the medical office survey, we have item sets on value and efficiency, diagnostic safety. And then for nursing home, this is what we're talking about today, an item set on workplace safety. On the next slide, I just want to provide you with the framework that ties together workplace safety and patient safety culture, because this is really the framework that we use to start developing item sets on workforce safety to accompany a patient safety culture survey. So the National Action Plan to Advance Patient Safety identified 4 foundational and interdependent areas that are essential to advance patient safety. So one of those foundational areas was culture, leadership, and governance to ensure commitment to safety as a core value and promote the development of safety culture in organizations. Another was workforce safety, and they stated that workforce safety is a necessary precondition to advancing patient safety, and that we need as healthcare providers to work towards a unified total systems-based perspective and approach to eliminate harm to both patients and the workforce. The other foundational areas being patient and family engagement and establishing a learning system. So again, thank you for joining us today, and I'm going to turn this over to Tanya.
Thank you, Karen. I'm really honored today to be able to discuss some things that we have done in our journey with our organization over the last couple of years with workplace safety. What I would like to cover today and discuss is why did we choose this as a priority, and how did we choose this as a priority, and what actions did we do, as well as just the results from the survey, as well as the results of our actions. Next slide. First, I'd like to do a system overview for you so you can understand our organization and hopefully be able to identify with your areas. We do have 2 hospitals in our healthcare system. There are 314 licensed acute bed. We do have freestanding emergency department, various provider-based clinics, inpatient, outpatient services, which also does include inpatient adult and adolescent psychiatric department, joint venture ambulatory surgery center, a residency program. We do have a skilled nursing facility that is inside of our EAMC hospital site that is a 26-bed that participated in this survey, as well as the nursing home that is a standalone nursing home of 90 beds. We have had a change of ownership with that nursing home recently, but this nursing home was included with our survey and all of our actions that we're going to discuss. We also have the EAMC Lanier site that's 115 licensed beds. We do have a senior behavioral health and a geropsych unit there, inpatient, outpatient, emergency services, also have a joint venture ambulatory surgery center. And the uniqueness of this long-term care nursing home is that it is also connected to the hospital. It is secure, but it is connected to the hospital. Next slide. So why do I have this up here? This really talks about our department of the Office of Patient Safety. And the reason I have this here is so you can see how all of these things are tied together for our resident and our patient safety. We are a lean methodology organization. We have in the past taught our staff and new employees lean methodology, and we had an interruption when COVID occurred. So we are getting back on that this year. The reason this is important is I want to speak about the structure that you initially have, which really drives your safe culture and how you address moving forward with workplace safety. We do cover the patient safety, resident safety, project management. You can see their environment of care, the PI, accreditation. We also assist in the past with state surveys and complaints, surveys, and different things also with our long-term care. Next slide. So what do we do here at East Alabama Health? We branded this back in 2009. We chose to select Epic, not as the computer system, but as East Alabama Performance Improvement Culture. We wanted people to really understand this was a culture. This was not, we're going to do this month. We are embedding it in everything that we do, which is really the lean culture. And as you can see there, and we've all known and seen examples of this, is increase in standardization, reducing that variation of how you do things, reduces, which leads to improvements, and it does give better safety and quality to our patients. Next slide. So that's the baseline of where we are. That's important to know the structure of where you are before you begin something. And so we go to workplace safety. What really motivated us to have this as a focus? We saw increases in our workplace violence. We saw increases in reporting on our incident system with our employees. We knew where we were. We saw the increase in burnout and stress and different things with COVID and the pandemic. So we had some significant things to happen on some of our campuses. We knew that we needed to create that as a focus and move forward. So how did we prioritize? I selected this picture purposefully. If you have not felt this way in the last few years, I'm surprised. We have had lots of different priorities. We've had lots of immediate changes, unexpected changes, to where sometimes you feel like you just are not sure where your attention needs to go. Our administration was able to set this as a PI priority for our entire organization. So you can see that straight line there. Your administration has to lead this and understand where you are to be able to be successful. Next slide. So some of our journey, this is a brief overview, and then we will discuss in more detail as we move forward, is setting it as a priority, as we just discussed. We thought we knew where we are. You can always assume that you know the answers and that you know where the problems are to address, but you have to confirm that with your staff. And that is exactly one of the reasons why we surveyed. So we surveyed with the hospital first. We had the opportunity to participate in the trial with the workplace safety section with the hospital before the nursing home. So we did that back in the summer of 21. We also went ahead. If you know some of the items that you need to focus, go ahead and move forward while you're waiting on the survey and the results. So we went ahead and established a team. And then we implemented our Plan, Do, Check, Act, which is our PI model for our organization. And then we're looking to sustain it. The one thing that we also did was we performed an anonymous open-ended questions survey to some of the areas that we knew were key areas that had increased risk in those areas. And we also went and had some open feedback in some of those areas at certain shifts as well. Gathering information from multiple avenues is very important to be successful. Next slide. So our team, as you know, to be successful, you have to have the right representation and the right people on your team initially to be successful. So you do not have to take a few steps back as you develop some plans and move along. So our administration led this task force. We also have representation from human resources, nursing, IT, plant engineering, education, patient safety, additional off-campus for some of our provider base in our nursing homes and long-term care. You may not have all these resources as additional people, but you would need to have these areas represented with these topics on your team as you move forward, because all of them have key information for workplace safety and resident safety as you move forward. The one thing that we did was gather the information that we discussed. We did need to develop the goals. You do not have to have multiple goals. Stay small and focused, and those will end up affecting lots of other areas, as you know, and establish some timelines. Next slide. So this right here is where we really started doing things. So I hope that some of these ideas can help you. In the meantime, we actually did a risk assessment of our exits. And we went to all of our exits at all of our nursing homes and our hospitals. And not just one person, we had the leader, we had risk assessment, we had security and patient safety. It is good to have multiple people to see different aspects of those exits that you're looking at. In addition, we did the focus survey that we've already discussed, and we developed a trained critical debriefing team. We had a couple of retired employees that were trained in this and wanted to give back. So we have contracted with them as needed. So many people out in your community can help you with this. And we had an opportunity to implement this debriefing team, and the staff and the response was overwhelming. They really felt supported. They had follow-up. And this has been a key thing for our organization to have. We also review multiple resources. There's lots out there that you can get information on with workplace safety and workplace violence. And then what did we do? We had to go ahead and respond. Some of these actions we began while we were surveying and after we surveyed. One of the things that we developed that we heard most staff say is we don't really know how to recognize the early signs of aggression. We do not know how to de-escalate these issues when identified. So we created an internal education to provide to new employees as well as annually for this de-escalation. We also have now an annual active shooter education. This is really important, especially in our skilled nursing facility. Our skilled nursing facility is within our hospital. There is no barriers. If we have an active shooter in the hospital or any other workplace issue, it will affect our skilled nursing facility. So we worked with our local police department and we developed an internal video that was a simulation. Let me tell you why that's important. Is when staff view it, they see their peers and it's very impactful for them and they finish watching the video. So this is really important as we move forward to think about how you can connect with the staff. Something else is we implemented a panic button system within our organization. We did this at the hospital. We choose one out of the 3 long-term cares. And you may ask yourself, why did you only do one? We did a risk assessment in those areas. And what we found was all the other areas were more secure and locked down besides the one that was in the hospital. So where there were multiple other things that impacted their safety. So we, in looking at the past reports, it also replied and looked at that risk management, that risk assessment that we did there showed that. The next thing is we developed a process for every incident that is involved with the employee and workplace violence actually automatically goes to HR and security and now patient safety and resident safety. So as long as you have a process of that, and now HR responds within 24 to 48 hours to that employee to see if there's any additional follow-up. And then we also have a counselor that is contracted as needed that will follow up with employees if needed. And then we had an additional leaders. It's called 50 for the Future at our organization. These are staff members that may not carry the title of a leader or a management position, but they are truly leaders. We asked them their thoughts. We asked them what was occurring in their areas. What did they need? We needed all these multiple avenues of information to come through. Some additional things that we did was we increased our LED lighting. We are continuing visitor management. And then we also had secured some additional entrances for just badge access only. And we also had an external security assessment performed by a healthcare security professional. And they looked at all of our facilities, including our long-term care and our nursing home, to look at our policies for workplace safety, as well as our processes and the environment. Next slide. So some additional things, our nursing homes did all of those things that we discussed, but there were some additional. Nursing homes are unique, as you all know, and they are not always comparable to a hospital. So one thing that we did was we did a complete facility lockdown with badge access for the employees with a video doorbell for the visitors. So now we also have an app that is on a cell phone that is for the department in the nursing home, and they can see when that doorbell is ringing, and it is the visitors are, you can view them, and it is limited people that can actually let them in. And so it's a very controlled entrance area for the public to be able to come in. We also noticed that we needed some additional surveillance cameras. So we expanded those and noticed that some of our staff needed to be reminded of our safe rooms. What we have done in our nursing homes is a very simple, small silver silver triangle, and we put it on the door facing. And that safe room is identified if it is a room where you can go in, it has one entrance, and it can be locked. So if you have an active shooter, you would immediately find one of those rooms, and that is your safe room. Next slide. So what did our survey tell us, and why was that important? Again, you need the staff to be able to tell you what the answers are. You need anonymous feedback, and you need high responses for accurate answers. Our response rates range from 44 to 74% in our 3 sites that we have. And some of our opportunities are here. So the triggers into the de-escalation, the staff did say, we do not know how to do this. About the time we were issuing and assigning the education was the time that we did the survey. So we feel comfortable that we address that we have that education out. The next thing that we didn't know that the survey provided for us is that staff said they need more equipment and devices for moving and transferring and lifting. And as the nursing home, that completely makes sense. So we're reevaluating what those exact needs are and where they're located. Sometimes they are not located in the correct spots as well. The last thing was management support. So that may surprise you, but the one thing that you need to do with a survey is look also back, not just at the workplace safety trial section, but at the entire survey on patient safety. And what we saw the trend of is they really felt we're above average on feeling non-punitive, that they feel very good about reporting. They feel safe in lots of different ways and support. This correlated more with the organizational learning. And what that means is they're not 100% sure what we do and how we respond to our mistakes or our issues that occur in the nursing home. So a lot of this is we assume that our staff understand why changes are implemented, but sometimes we do not always explain why changes are implemented and why that increases our workplace safety or whatever it is increasing the safety of. So this is very important. One of the opportunities when we saw this with our administrator is they decided now they're going to be moving forward and coming in on night shift one day at least a month and just performing their entire shift. No purposeful, not just 1 hour, but just being available where there's transparency and people have open communication avenue at that time as well. And also just being able to understand that they feel safe in that transparent communication, and then being able to share in person with staff while changes are being made. The other important thing is to share the results of the survey. Many times staff said they will ask, what did we do with the results of our survey? That is very important. Next slide. So moving forward, some additional things that we have done, we had the opportunity to participate in a state grant that offered some free classes for our management. Part of this survey has burnout and stress, which is certainly something we have seen everywhere in the last few years. This training offers identification for management for the staff, early on intervention to see if we need to help with stress and burnout. The additional thing is we're expanding our multidisciplinary review of our workplace safety to where human resources, security, and patient safety will be looking every month at our workplace safety instances and being able to trend those to see what our additional needs are. And then from there, we will develop metrics. Next slide. So workplace safety is really resident safety. When our staff feels safe and they can communicate their needs and see the impact of their feedback, then we're going to increase our safety and our quality, and our residents will be safer as well. Next slide. I really hope what I've shared with you is helpful for you. I hope to maybe even hear from some of you if you have great things that you've implemented. But I think this concludes my presentation today, and I will hand over to Naomi.
Thanks so much, Tanya. I'll now discuss the development of the workplace safety supplemental item set, share results from our pilot study, and provide information about available resources. Next slide. The workplace safety supplemental item set is designed to be added towards the end of the SOPS nursing home survey, and it assesses the extent to which the organizational culture supports workplace safety for staff. Next slide. We followed a similar survey development process used for all the SOPS surveys and supplemental items. First, we reviewed the literature on workplace safety issues and looked for existing surveys. We also obtained input from a technical expert panel and interviewed workplace safety experts and nursing home staff to identify key thematic areas of importance to assess with these items. From these areas, we developed a set of draft survey items and tested them over 4 rounds of cognitive interviews with a total of 31 nursing home staff. After each round, the items were revised again based on this feedback and tested again. In addition, at key points in this development process, we obtained feedback from our TEP and workplace safety experts, and I just want to take a moment to thank them again for much of their important contributions to this development effort. And then last summer, we pilot tested the draft items and used the data to conduct psychometric analysis to ensure the items were reliable and valid. We then finalized the items for release. Next slide. The item set includes 6 composite measures that assess protection from workplace hazards, moving, transferring, or lifting residents, addressing inappropriate resident behavior towards staff, interactions among staff, and then supervisor and management support for workplace safety. Next slide. There are also 3 single item measures: workplace safety reporting, work stress burnout, overall rating on workplace safety for staff. And there are 2 additional background questions asking about job satisfaction and intentions to leave the nursing home within a year. And this is a total of 23 items on the item set. Next slide. So as noted, we conducted the pilot study in nursing homes to conduct psychometric analysis, and I'll share these results next. Next slide. The pilot study was conducted via web and paper from July to September in 2022 in 48 US nursing homes. Nursing homes were recruited to vary by bed size, region, ownership, and teaching status. We obtained responses from approximately 2,500 staff out of 6,000 survey invitations for an overall response rate of 40%. And on average, there was 52 respondents per nursing home, ranging from 10 to 149. Next slide. About 30% of respondents were nursing assistants or aides. 74% worked on the day shift. 71% were satisfied or very satisfied with their jobs. And 71% indicated that they did not intend to leave their nursing home. Next slide. So the results are shared as percent positive scores. So I want to take a minute to discuss what these are. A percent positive score is the percentage of respondents selecting the 2 most positive response options. For positively worded items, such as staff use PPE appropriately, the percent positive score is the percentage of respondents who selected agree or strongly agree. Next slide. For negatively worded items, such as staff are rude to other staff in this nursing home, the percent positive score is the percentage of respondents who selected strongly disagree or disagree. Next slide. So we calculated percent positive scores for each nursing home and then averaged them across the nursing homes to get this average percent positive response shown on the slide. The composite measures shown here are ordered from the highest percent positive to the lowest. So moving, transferring, or lifting residents had the highest average percent positive response at 87%, and interactions among staff had the lowest at 57%. The average of the 6 composite measure scores was 74%. Next slide. The highest scoring item in the moving, transferring, or lifting residents composite measure asked if staff use equipment or assistive devices when needed to help move, transfer, or lift residents, and was at 92% positive. The other 2 items asked if equipment or assistive devices are available when needed at 87% positive, and if they are in good working condition at 83% positive. Next slide. We also collected a few open-ended comments from respondents. So 2 comments for moving, transferring, or lifting residents are, we need some new lifts. The ones we have sometimes tilt over when we try to get a resident up. And some of the stand aids tip. There are hooks in residents' bathrooms that I've hit with my arms or even back more times than I can remember. Next slide. The highest scoring item in protection from workplace hazards asked if staff are provided with PPE and was at 93% positive. The remaining 3 items asked whether there are good procedures to protect staff from contagious diseases, body fluids, or hazardous materials at 90% positive, if staff use PPE appropriately at 75% positive, and if staff clean their hands before and after helping residents with personal care at 83% positive. Next slide. 2 quotes from this measure are, staff are well trained on the basics, washing hand procedures, face covering, wearing gloves, and other etiquette. And there are poor procedures with active COVID management, needs to step up and frequently educate staff and make sure they are aware of new cases and that they are wearing proper PPE when caring for positive patients. Next slide. So 2 items in the supervisor support for workplace safety were both 80% positive. 1 item asked if their supervisor encourages staff to report their concerns about workplace safety, and the other asked if their supervisor can be trusted to do the right thing to keep staff safe. The 3rd item assessed if supervisors listen to staff ideas and suggestions about workplace safety and was at 74% positive. Next slide. Sample comment for this measure is, I do not feel comfortable going to my superiors for help because in the past, nothing has been done regarding issues until something big happens, resulting in staff or patient injury. Next slide. 2 items in management support for workplace safety were both 69% positive. 1 item asked if management provides adequate resources to ensure the safety of staff, and the other assessed if management takes action when staff report concerns about workplace safety. The final item in this measure is if the actions of management show that safety of staff is a top priority, was at 64% positive. Next slide. 2 sample comments for this measure are, we need new management all the way around. They stay in their offices while you are on the floor drowning. And upper management does not seem to take staff complaints seriously. Staff are treated differently depending on who they are. Next slide. The first item in addressing inappropriate resident behavior towards staff asks whether staff are trained to identify triggers or situations that could lead to inappropriate resident behavior, and was 69% positive. This was followed closely by the item on if staff are trained on how to de-escalate or calm down situations when residents are agitated or upset at 68% positive. And finally, the last item asks if there are good procedures to keep staff safe from inappropriate resident behavior, and that was 63% positive. Next slide. 2 sample comments for this measure are, I have never received formal training on de-escalation of situations or training for residents with behaviors. And staff safety doesn't seem to matter. Violent residents are just accepted as part of being a nurse. There are no staff resources for dealing with abusive or violent residents. We are expected to accept the treatment and nothing is done about it. Next slide. Okay, the first item in interactions among staff asks if staff are rude to other staff in this nursing home, and it was 47% positive. As a reminder, this item is negatively worded, And so the percent positive score means that 47% of respondents indicated that staff are rarely or never rude to other staff. The next item assessed whether staff bully other staff in the nursing home. And this item too is negatively worded. So it's showing that 66% of respondents indicated that staff rarely or never bullied other staff in the nursing home. Next slide. Okay, the two sample comments for this measure are there consistent issues with certain staff members being rude to residents and fellow staff. Nothing is done to help this. It makes coming to work hard sometimes. And some staff are excessively rude to others. Next slide. So for single item measures, we have workplace safety reporting, and we found that 71% of respondents strongly agreed that they can report their concerns about workplace safety without fear of negative consequences. Next slide. A sample comment here, though, is we can't report issues because of feared retaliation, and upper management are super big on retaliation. We feel as if we are not important here, as well as not listened to. Next slide. The item on work stress and burnout has 5 response options. The first 2 represent the percentage experiencing no symptoms of burnout, and it was 67%. The last 3 options are those experiencing symptoms of burnout, and we see 33% answered this way. About 2% said they felt completely burned out to the point where they may need to seek help. Next slide. 2 sample comments here are: we are getting burned out on a job we were so passionate about because of management and understaffing problems. And staff are burned out and tired. So this means resident care is not what it should be. Next slide. Finally, we asked them to rate their nursing home on workplace safety. On average, only 51% of respondents provided an overall rating of excellent or very good. Next slide. We have 2 positive quotes here. Our nursing home is well organized and a perfect place for the residents as well as employees. And I feel safe in my workplace. We give good care, but it would be better at times. I like my job here and the residents and staff I work with. Next slide. As I mentioned earlier, we perform psychometric analysis to examine the reliability and construct validity of survey measures. So we examined internal consistency reliability and site level reliability and found that all measures had accepted reliability. We also conducted confirmatory factor analysis to assess the validity of the measures and found that all factor analysis results were acceptable. Finally, we examined the correlations among the workplace safety composite measures and single item measures and found that most were statistically significant, yet were low to medium in strength, which indicates that the survey measures unique but related aspects of workplace safety culture. Next slide. Okay, so the final workplace safety supplemental item set is available in both English and Spanish, as well as the full results from the 2022 pilot study. And that's available on the AHRQ website at www.ahrq.gov/SOPS. Next slide. In addition to releasing the item set in English and Spanish and the pilot study results, there are a few other resources available. Next slide. The data entry and analysis tool uses Microsoft Excel and allows you to enter survey data, and the tool will automatically calculate your results into nice tables and graphs. It'll also compare the results to the latest database average. There's a tool for each survey setting and supplemental item set. These Excel tools are the only resources not physically available for download on the AHRQ website, but you can request a copy by contacting our help desk, which I'll provide in just a minute. Next slide. So AHRQ recently also released the 2023 Nursing Home Survey User Database Report. This report includes data from 62 US nursing homes and over 3,000 nursing home staff respondents. You can access this report by visiting www.ahrq.gov/SOPS/databases/nursing-home. Next slide. Another resource is the SOPS Action Planning Tool, which assists you in developing an action plan based on your SOPS results to improve patient safety culture in your organization. The Action Planning Tool is designed for all survey settings and supplemental item sets and provides step-by-step guidance to help users develop an action plan. The tool includes an action plan template that you can use to identify your areas to improve, plan your initiative, as well as communicate your action plan. Next slide. There are also SOPS Improving Patient Safety resource lists that they're available for each survey setting and supplemental item set, such as the SOPS Nursing Home Workplace Safety supplemental item set. And so these documents contain links to practical resources that are free and publicly available to help improve safety culture and are listed by the related SOPS composite measures. Next slide. We offer free technical assistance, or TA, to SOPS survey users. So we have two ways to contact us. Our general TA help desk can be reached at 1-888-324-9749 or via email at safetyculturesurveys@westat.com. They can help you with questions about survey administration, connect you with any of the survey materials or for supporting resources, and international users can request permission to use any of the SOPS surveys in their respective countries. And then our database TA help desk can be reached at 1-888-324-9790 or databases on safety culture at westat.com. And they can assist you with submitting to the various databases, send you the SOPS data entry and analysis tool, and answer questions about the database reports. And we're really happy to help you, so please do not hesitate to contact us with any questions. Next slide. So we periodically send announcements through SOPS email updates, notifying users about various SOPS products, such as the webcast we're doing today. You can sign up for these email updates by going to the top right corner on the AHRQ website and choosing email updates associated with surveys on patient safety culture. Next slide. Okay, so now I'm going to turn it over to Joanne to facilitate the question and answer session.
All right, thank you, Karen, Tanya, and Naomi, for your really informative presentations. You shared a lot of helpful information about the new workplace safety item set for nursing homes. As a reminder, you may ask a question through the Q&A feature. If we go to the next slide, we'll show what that looks like. You'll look for the Q&A icon, and we encourage you to share your name and organization or role when you type your question. If you joined late, a replay of today's webcast will be made available on the AHRQ SOPS website. So please go ahead and enter your questions now for our speakers. So as we're waiting for some questions to come in, Naomi, I have a couple of questions that I think we'll go ahead and ask, because a lot of people might be wondering. So do you need to use all of the supplemental items in this item set, or can users pick and choose which ones they want to use?
Thanks, Joanne. The workplace safety supplemental item set, and in fact, all the supplemental item sets are designed to be administered in their entirety. And this is how the items were tested. So removing items or selecting only certain items or changing item wording or response options can affect the validity and reliability and the ability to compare your results with other entities such as nursing homes.
All right, thanks. And can the supplemental item set be an option for users, or is it required to be part of the core nursing home survey?
It is not required. The item is supplemental and designed, again, to be administered at the end of the SOPS surveys. They are not required. And in fact, it's important to note that none of the items respondents should be forced to answer. So any item can be left blank by the respondent.
Okay. So again, feel free to type in a question using the Q&A icon. It looks like we have a question from Stephen Greenwald. And I think, Tanya, this is probably for you. What do people need to hear, learn? Oh, I'm sorry. What people need to hear, learn, and know is how best to prevent difficult behavior symptoms. What are the best proactive methods and the best methods for managing inappropriate behavior?
So we have a few people that have CPI, and I'm not necessarily promoting them, but that is what we use. Is we have Crisis Prevention Institution, and that is CPI training that they have. And so that is, you can actually have some people be trained in that. They can actually teach it. But that is where we got some of our education from, to be able to de-escalate and to be able to recognize some of those behaviors. So I would probably refer you to look at some of those, and that will be able to share and give you some of that information that you're looking for.
Thank you. Another question is, why should nursing homes that haven't previously done the nursing home survey on patient safety culture do this survey, do the nursing home survey or the workplace safety item set? And I'm wondering if Karen Ginsberg from AHRQ might want to answer that, and as well as Tanya.
Thanks, Joanne. I'll start off. I think there are a lot of reasons to do this survey if you haven't done it before. And, we once talked to a nursing home administrator a while ago, I think when we had our last nursing home webcast, who said, we asked her that question and she said, well, I can't afford not to do the survey. And I think she was talking in reference to the information she got from the survey that helped her with meeting her requirements for safety, for accreditation. They just gave her the information that she needed to know. And she felt that it was, a business decision to have to do this survey in order to stay in business. I think you can also point to some of the unique characteristics of this survey and our program, which are also, I think, important for you to realize. First of all, these are surveys of employees and staff, and they're the only ones who can really tell you certain things about safety from their perspective. And if you don't survey employees and staff, you're going to be missing a lot of information about the safety culture of your environment. And you need to know this in order to, understand where you sit in terms of safety and what you should be doing about it. We ask that you make these surveys confidential and not be able to be tied back to an individual in their setting, either the short answers or the or any comments that you receive. I also want to point out that if you use these surveys, you get a lot from our program. We have a phenomenal technical assistance and support function at WestStat, and we will make it easy for you to administer the surveys. We can't administer it for you, but we can make it easy, give you the resources, the tools, the support you need to move forward. We have a huge library of technical assistance and guidance documents and other materials that will help you. And we develop tools to help you administer surveys too, and use the information, the Excel analysis and reporting tool that Naomi talked about, as well as our action planning tool. So I think those are a lot of reasons that you should consider using this for understanding safety culture in your organization. And Tanya, do you want to add to that?
Sure. I think the main thing I would add is focusing on what Karen said about the anonymous. This is really your only avenue to have an anonymous feedback from all of your staff. And it provides you a baseline. If you've never had it before, it's going to provide you that baseline. And if you continue performing it, it's going to be able to show you the trends. For an example, on one of our surveys, it looked to be a little negative. And then we looked back, because we were able to administer this back in 2019, and we actually saw the trend of improving in 8 of the 12 categories. So it really narrowed down the opportunity that we had of, okay, this is really what we need to focus on. We're improving and trending forward with these. Let's continue to improve these and do what we're doing. So I think it provides you that anonymous feedback that is very important, because if you do not have a safe culture, you need to have that anonymously. And as you're developing that, it also indirectly tells your staff that you're interested in their opinion, and then you're able to give them feedback. So if anything, it also opens up that communication to let the staff know that you really are striving to have a safe culture.
Great. Yeah, great points, both Karen and Tanya. Thank you. We have a question from Barbara Braun. Are there workplace safety supplemental questions for other settings or SOPS surveys? This is probably for Naomi.
Yeah, there are. So in addition to the workplace safety items for nursing homes, we have released workplace safety supplemental items for the hospital survey. That was released in the fall of 2021. And since then, we've actually received data from hospitals who voluntarily submitted data in the last database. And so we have updated results from the pilot. These materials are available on the AHRQ website as well.
All right, and looks like we have another question for you, Naomi, from Caroline Christensen. Great presentation, thank you. Is the nursing home SOPS survey and workplace safety supplemental item set appropriate for use in assisted living settings?
That's a tougher one. The survey is designed specifically for nursing home providers and staff. And so it was tested in that facility and it was not tested in assisted living facilities. So it really wasn't designed for use there. And we can't speak to how well it, how well it applies to that setting.
All right. Another question for you, Naomi. Can the nursing homes administer the workplace safety supplemental item set as a standalone survey without administering the nursing home SOPS survey?
So the supplemental item set's really designed to be administered toward the end of the SOPS survey. Before the background questions, it was not designed as a standalone instrument. It was not tested that way. I will just add too that there are elements in the core nursing home survey that are not assessed in the workplace safety survey. So things like staffing, which we know are really important for workplace safety, is assessed in the core, and for that reason is not part of the supplemental item set. So they're really designed to be administered together, not as a standalone supplemental item set.
And Tanya, you were commenting in your presentation about how you administered the core SOPS survey. Was it in 2019? And then you saw it again when you participated again in 2022. And do you want to just say a little bit about how helpful it was to have the 2 points in time?
Well, interestingly, the one in 2019 was before the pandemic. And then we saw the trend in increasing and improving in 2021, which was quite interesting to see that. And that was great to see. And the other thing is looking at it as a whole, to add on to what Naomi was saying, it is very important to not separate those answers. Some of your workplace safety may be deriving, and your culture may be deriving from your safe culture. So what we did was we looked at the answers and really saw the correlation of those two, which helped us see where the focus area needed to be, such as the organizational learning on the core survey, and then the management support on the workplace safety. And as we saw that, it was more of a communication closed loop that we had an opportunity to share what was going on in the nursing home and how are we addressing it. And that really is how you show the support, is with that communication. It goes hand in hand.
Those are great points, Tanya, because the item set, the workplace safety item set, was developed in conjunction with an understanding what was already being measured in the core nursing home survey. And as the National Action Plan to Advance Patient Safety points out, culture and workforce safety, they're related. And as you pointed out, that workforce safety is resident safety. So they're really tied together. Naomi, I think there's another question. Maybe this will be the last question. What's the best way to improve patient safety culture? Resident safety? Oh, you're on mute.
Thank you. There really is no one best way. It really depends on where your organization is currently. What are your strengths? What are your challenges? So therefore, the first step really is to assess your patient safety culture or workplace safety culture. And then to do this, you can use one of the SOPS surveys or supplemental item sets. Then you review your results and use the SOPS action planning tool. It's a resource there to help you identify what you might want to focus on for improvement. And once you know those areas you want to improve, you can use the resource list to help identify initiatives to implement. You might also want to refer to the SOPS bibliography, which is also on the AHRQ website. And that has articles where they may have implemented one of those initiatives and talked about how it impacted safety culture. And then you can assess it again and see how the initiatives worked.
Great. Well, thank you very much. It looks like we're at time. Let's go to our final slide. And I just want to thank everyone for attending today. Brief webcast evaluation will pop up when you close out. Please take a moment to provide us with your feedback because it helps us improve our offerings and future events. We invite you to visit the AHRQ website and contact us at any time by email or phone. Thanks again for joining us. This concludes today's presentation.